Hello, welcome to MedZone by Dr.farjana Afrin. Today my video lecture topics arm. In this video lecture, I am going to describe about the different compartment of the arm, muscles in each compartment, their nerve supply and action. So let's start. On screen, you can see the two different images. Let's denote them figure A and figure B. On figure B, you can see the different layer of the muscles and the vessels and deeper structure. The first we are going to get should be the skin. After that, the fascia layer, then there will be the muscles, and there will be the more deeper structures, bones. And we know in arm there will be humerus, a single bones. Now, in the arm, if we do transverse section, then will be the figure A image. So, in the middle there is a single bones, that is humerus, more center, more deeper. Now, externally the first layer is the skin. After that, this is the superficial fascia, then there is the deep fascia, then inside there will be the muscle vessels, nerve, and more deeper and center is the humerus. Now, you can see in a screen the deep fascia, it is moved inward from both the area and heading towards the humerus and forming a septum. We are saying name of this septum is called intermuscular septum. And these intermuscular septums on the lateral side, so lateral intermuscular septum, and on the medial side, so medial intermuscular septum. It is nothing but the deep fascia, connective tissue. And with this septum, the whole arm is now divided into two compartments. One is the posterior compartment, another one is the anterior compartment. In posterior compartment, there is a single muscles with three head, that is triceps brachii, long head, lateral head, and there is medial head. In the anterior compartment, there are total three muscles. One is brachialis, then biceps brachii, long head, and short head. One more muscle is not showing here, that is coracobrachialis. So, in the anterior compartment, total three muscles. Now, each of these muscles action nerve supply is important for us. Let's summarize the point what we described right now. First of all, we know in the arm there are two compartments, anterior compartment and another one is posterior compartment. The anterior compartment function wise it do flexions, that's why flexor compartment, and posterior compartment muscles do extension, so it is extensor compartment. Okay. Now, anterior compartment muscles. We already know our flexor compartment muscles. The muscles are coracobrachialis, then biceps brachii, then brachialis. On posterior compartment or extensor compartment, there is only one muscles. What is the name of that? That is triceps brachii. That's all about the muscle. After the muscles, next question will be arising, what is their action? For knowing the action, it is better to see the muscle arrangement. Then the action will be little easy. So let's see the muscle first. The first muscle here you can see is the coracobrachialis, the muscle which is originate from the coracoid process of the scapula and inserted into the middle of the shaft of the humerus anteromedial surface. Now, one more point also we have to remember, this muscle is pierced by a nerve which is coming from the terminal branch of lateral cord of brachial plexus, that is the musculocutaneous nerve. After piercing these muscles, the nerve will be coming to the front of the arm and it will be supplied to the rest of the muscles of the front of the arm. So, coracobrachialis. Here one point we have to remember, coracobrachialis only cross a single joint, name of that is shoulder joint. This point you just remember, because later on when we are going to discuss about the action, we have to know the muscles is crossing actually what joint, because it will be working on that joint only. So, coracobrachialis related, this much is enough for us. After that, we are going to see biceps brachii and brachialis. So biceps, so it does have two head, short head and long head. The short head, it is arising again from the coracoid process of the scapula, and long head arises from the supragluteal tubercle of the scapula. The both head will be heading down and united with each others and forming a single muscle. It will be cross a joint. Now, what is the name of this joint? Name of this joint is called elbow joint, and reaching toward the radius on the radial tuberosity, it will be get inserted. So here basically two joint, though the biceps brachii is crossing, but mainly work will be on the elbow joint. The second muscle is that. Now come for third muscle, that is the brachialis. Brachialis origin from the middle of the shaft of the humerus from both the anteromedial and anterolateral surface heading down, and it will be cross a joint, that is elbow joint, and reaching into the ulna. On the ulnar tuberosity it will be inserted or finished. So starting from the shaft of the humerus and finishing into the ulnar tuberosity and crossing a single joint, that is the elbow joint. Okay. Now come for action. You have to remember, when a muscle cross a joint, work on that joint. Coracobrachialis only cross the shoulder joint, so it will be work on the shoulder joint. Biceps brachii cross the shoulder joint and elbow joint, but it does have pronounced action on the elbow joint. And brachialis cross only again a single joint, that is the elbow joint, so it will be work on the elbow joint. Now summarizing the all actions related with the anterior compartment or flexion compartment or flexor compartment, let's start first coracobrachialis. The coracobrachialis, it will do adduction of shoulder joint. Then biceps brachii. The biceps brachii, it will do flexion of elbow. Now, one more very highlighted function of biceps brachii is it is a chief supinator. So, it can do supination. Next, brachialis. Only one joint is cross, so it will also do flexion of elbow. As maximum muscles do flexion, that's why it is a flexor compartment muscles also we can say. Now, what is their nerve supply? So, when we see the anterior compartment or flexor compartment of the arm muscles nerve supply, it has a main nerve which is piercing the coracobrachialis and supply to the all muscles, that is the musculocutaneous nerve. And we know the musculocutaneous nerve is coming from the lateral cord terminal branches. But we have to remember one more point, there is one more nerve also here contribute to give supply, that is the radial nerve, which is coming from the terminal posterior cord of the brachial plexus. Now, which muscle supplied by which nerve? You have to remember all the muscles are supplied by musculocutaneous nerve. The brachialis muscles here is the hybrid muscle. So, who is the hybrid muscle? The hybrid muscle is brachialis. It's supplied by musculocutaneous nerve plus radial nerve. Musculocutaneous nerve will be supplied to medial half and radial nerve will be supplied to lateral half of the brachialis muscles. All muscles are supplied by only musculocutaneous nerve. So, that is all about the anterior compartment related information. Now come for posterior compartment or extensor compartment of the arm muscles, and we know that is triceps brachii. So, first let us see the muscle. On screen you can see the triceps muscles. As it is triceps, it does have three head. The long head which is arising from the infragluteal tubercle of the scapula. Then there is a lateral head which is arising from the above the radial groove shaft of the humerus posterior aspect, and the medial head will be arising from the below the radial groove on the shaft of the posterior aspect of the humerus, and they all will be inserted into the olecranon process of the ulna. posterior aspect of the or posterior surface of the posterior superior surface of the olecranon process of the ulna. Here you just remember it's cross only one joint, and what is the name of this joint? Elbow joint. So triceps brachii will be work on which joint? Elbow joint, and already we know it is the extensor compartment muscles. So this muscle will do extension of elbow. And as the radial groove is behind and radial nerve is crossing through this radial groove, so what will be the nerve supply of this by triceps brachii? It will be supplied by radial nerve. So let's summarize. So triceps brachii action is extension of elbow. And what is its nerve supply? The nerve supply will be radial nerve, and it's coming from posterior cord of the brachial plexus. Now we are going to discuss about potential spaces which is located between the scapular muscles, triceps and the humerus. And these spaces are three in number. One is quadrangular space, then upper triangular space and lower triangular space. We have to know the boundary and content of each of the space. Let's first see the muscle. This is the teres minor muscle and this is the teres major muscle, and this is long head of triceps. This is the lateral head of triceps, lateral head of triceps, and this is of course humerus. We also have to denote that. Now first let's start. What is the boundary of quadrangular space? So quadrangular space actually we are seeing from back side, but front side also there is a muscle. So what is superiorly? Superiorly there are two muscle. One is visualized here right now on the screen, but another one which is in front that we are not seeing. So superiorly there will be subscapularis, that is going in front on the lesser tubercle of the humerus. It will be inserted, which muscle is not visualized from back, and capsule of the shoulder joint, capsule of shoulder joint, and just now whatever the muscles I said here, what is the name of this? Teres minor. So lower border of teres minor. This is superior boundary. What is inferior boundary? Inferior boundary will be these muscles. What is the name of these muscles? This muscle is teres major. So superior border of teres major. What is medially? Medially here will be the lateral border of long head of triceps. So long head of triceps. What is laterally? Laterally there is surgical neck of humerus. Surgical neck of humerus. So what should be the content of this quadrangular space? So as there is surgical neck of the humerus, we can understand there should be axillary nerve. There should be axillary nerve, you can see here, and one artery is there. What is the name of that artery? Posterior circumflex humeral artery. Posterior circumflex humeral artery. That's all about the quadrangular space. Now come for upper triangular space. Upper triangular space. So what is the boundary of upper triangular space? In upper triangular space, we have to remember superiorly what is the boundary. You just see here, what is the superior boundary? Superior boundary will be the teres minor. So superiorly teres minor. And what is inferiorly? Inferiorly will be the superior border of teres major. So inferiorly teres major. And what is laterally? Laterally will be the long head of triceps. This is the boundary. What is the content? Actually through here one artery is coming to the infrascapular fossa to make anastomosis into the infrascapular fossa. It's a branch of subscapular artery. Name is circumflex branch of subscapular artery. So what is the content? The content will be circumflex branch. Circumflex branch of subscapular artery. That's all about the upper triangular space. Now let's write about lower triangular space. Now if we see the lower triangular space, the lower triangular space is here. So what is its boundary? If we see superior, so what is superiorly? Superiorly will be these muscles. What is these muscles? Already we know this is the teres major. So teres major is superiorly. The upper border of the teres major is superiorly. What is laterally or what is medially? Medially there is the we can say here the lateral border of long head of triceps. Long head of triceps. And what is laterally? Laterally this is structure. What is this? It is humerus. So we can say humerus. Now what is the content of this lower triangular space? Through this area actually it is very closely related with the radial groove, and through the radial groove two structures are passing. One is radial nerve, another one is profunda brachii artery. So radial nerve plus profunda brachii artery. Now we are going to discuss about the different branches related with the arm supplying artery, which is coming from the brachial artery. So first things is we have to remember the brachial artery, it's a continuation of axillary artery. So brachial artery, it's a continuation of axillary artery. Let's here write first axillary artery. Now this axillary artery will be continue as a brachial artery, and this brachial artery have two terminal branch, radial and ulnar artery. Anyway, so let's start. What are the branches of brachial artery? So brachial artery continue as an axillary artery continuation from the lower border of teres major muscles, and it will be continued till the neck of the radius area, where it will be terminate into radial and ulnar artery. Now what are the branches? What are the branches of brachial artery? First of all, the brachial artery comes down and it's giving a branch which is going backside to supply toward the posterior compartment of the arm muscles. Name of that is called profunda brachii artery. Then it's giving some branches which is coming to supply to the anterior compartment of muscles. So we are saying it is called muscular branch. Then it will be giving one branches which will be supplied to the humerus. So what will be the name of that branch? Nutrient artery. Nutrient artery of humerus. Then it will give collateral branch. One is superior ulnar collateral artery and inferior ulnar collateral artery. And as we said, there are two terminal branch. What are the two terminal branch? There are radial artery and ulnar artery. Among, we have to remember, as we are discussing about arm, the two arteries here important. One is the profunda brachii artery, another one is the muscular branch of the brachial artery. The profunda brachii artery will be supplied to the posterior compartment muscles, and the muscular branch will be supplied to the anterior compartment muscles. So that's all about the arm related information.